Yesterday, we conducted about 10,029 tests throughout the Commonwealth, bringing our total to over 275,000 tests. There were 1,940 new confirmed cases of COVID-19. That's about a 19% positive test rate, which is consistent with the rate we've seen the past few days and significantly below where it was when we got started. We continue to hold daily calls with our healthcare leaders to closely monitor hospital capacity and hospitalization rates statewide. As of yesterday, 3,803 patients, which was again about 6% of all cases, were hospitalized due to COVID-19. This is the third day in a row that COVID-19 related hospitalizations have slightly decreased. While there are still thousands of people in need of hospital level care, this number has not gone up, which is a very good sign for a couple of weeks. And I would just say something I constantly say here, which is it's important for people to remember that a big part of why we put so much work, and you put so much work, into distancing, staying at home, only going out if you actually needed to, was to slow the spread. And it's also why we put so much work into working with our colleagues in the healthcare and hospital community to make sure that we would have the capacity when the surge got here to not just take care of the people who got ill because of COVID-19 during the surge, but that the hospital community and the healthcare system generally would be able to take care of everybody else too. And I'm pleased to say that we have heard from several of our colleagues in the hospital community that people have been coming into the ED, people have been sort of reacquainting themselves in some cases with the healthcare system, and we think that continues to be critically important. And I also want to say that we do know that there have been hundreds of thousands of telehealth visits that have taken place between clinicians and patients since we put that emergency order in place some 6 weeks ago. And that's turned out to be a very effective way for people to engage with their clinicians on a pretty regular basis without necessarily having to put either one in a face-to-face situation. Obviously, each part of Massachusetts is at a slightly different stage with respect to the pandemic. So when we see a statewide drop in patients who are being hospitalized for COVID-19, there are hospitals that have significantly fewer patients and that there are some that have significantly more. But overall, this is a very good sign. Frontline medical workers in many cases have been and continue to work around the clock. And because everybody's been playing their role and doing their part, they have the capacity and the ability to deal with the sickest patients who are dealing with COVID. And we continue to chase down every avenue that's available to us with respect to PPE to ensure the safety of our emergency responders, our frontline healthcare workers, and many of our vulnerable residents. And as of yesterday, we've delivered over 7.3 million pieces of personalized protective equipment, including masks, gowns, gloves, and ventilators. This gear is coming from a variety of places and going to a variety of places, but primarily hospitals, senior facilities, and first responders. As infectious disease specialists continue to learn more about COVID-19, it's clear that this virus is highly contagious and can be spread from person to person without symptoms. And what I mean by that is a significant portion of the people who actually carry the COVID-19 virus never show any symptoms at all, but they are in fact contagious. That means it's possible for a person to infect other close contacts with COVID-19 without knowing that they are infected themselves. We'll continue to do everything we can to expand testing to detect high infection rates, hotspots, and particular communities where we believe we need to be doing more testing. And we continue to arm our facilities with the supplies that they need to test larger and larger populations. And as we've said many times, while we work with the healthcare community to push back on the virus, everyone else has a role to play that's equally important. And as part of that effort, we've already advised that everyone should use face masks or face coverings in public spaces when they are unable to practice social distancing. As we continue to think about the future and a return to a new normal, covering our faces when we cannot practice social distancing is an easy, critically important, and essential step that everyone can and should take to stop or slow the spread. Earlier today, I signed an executive order requiring residents to use a face covering in public places when they cannot socially distance from others. This order does not apply to children under the age of 2 or to people who are unable to wear a face mask or a face covering due to medical conditions or other DPH-issued exemptions. I've also directed the Department of Public Health to issue additional guidance regarding children between the ages of 2 and 5 years old for parents and for guardians. This requirement applies to all workers and customers of businesses and other organizations that are open to the public. The public's required to wear a face covering at all times in grocery stores, retail stores, or on public transportation. The order goes into effect on May 6th.